Allie and Taylor from Beaten Jeans, and today we get to speak with Gabrielle. She had a gastrectomy and a double mastectomy, and we are anxious to hear about how her surgeries were for her and how she's doing now. I believe it's been a little over a year since she had her gastrectomy, and she's in med school. I could be wrong about that, but that is a lot of away from home time, and I wonder how she handles that with all her snacks and foods and being on her feet.
Right.
So we are anxious to hear.
Let's see, we've invited her in. Now we're just waiting. Hopefully, if you are watching, you are on your phone, not the computer, and just hit the accept button.
I wonder if it's because this is her too.
Oh, is that her?
Mm-hmm.
Oh, okay, let's try that.
We invited both of your accounts.
Here we go.
That was the problem.
Hi, sorry. I don't know how
Hi.
this works. I have never joined a live with someone else, so.
Oh, well, we're happy to be your first time.
I am joining you from my rental car in my school parking lot because my home Wi-Fi is very unreliable, so.
Okay.
Oh my God.
Well, that works, I guess, right?
Yeah.
Are you on like a break right now?
Yeah, so I just finished my live class for the day, and we have a lot of like individual self-study time at home. So I've got the rest of the day free, but we just finished up.
Oh, good. Okay, cool.
Yeah.
And where are you coming to us from?
I'm in Yakima, Washington at a small medical school here. So
Awesome.
Yakima. I've never heard of that.
it is on the other side of the mountains from Seattle. So we're kind of in like the wine country of Washington, like the Napa Valley
pretty.
of Washington.
Oh, nice.
I bet that's gorgeous.
It's a little deserty for my preference. I'm from Minnesota, so I'm used to trees and grass, and here it's rocks and dirt. But
Oh, interesting.
And what year in med school are you?
I'm in my first year. I'm just finishing up my first year.
Do you know what kind of doctor you want to become?
I used to want to go into like emergency medicine or trauma. And then after everything that my family's been through with CDH1, I was always running away from oncology, thinking it plagued my personal life too much. And now I feel compelled to work in oncology.
You have a calling.
Yeah.
And you probably have so much knowledge from going through it that
You'll be able to relate to your patients.
I think that's really smart.
Yeah.
Good.
Well, we're so happy to be able to speak with you today and learn more about your experience with this mutation.
Yeah, me too.
So I think we typically just have everyone kind of start us off at the beginning. Like, what made you get tested? How did you discover you were a carrier?
So growing up, I had a lot of extended family that had various cancers. And then both of my grandmothers had breast cancer around the same time when I was probably 12 years old at that time. And I kind of had known from media and whatever about the BRCA mutations. And it was just fishy to me that on both sides we had a lot of cancer. And it was just a stressful thing for me as I was kind of like going through puberty and whatnot. So I always expected that there was some reason this was happening. And I kind of decided really young that I did not like my odds for breast cancer. Then my dad got diagnosed with prostate cancer, and it finally qualified me through my insurance to get genetic testing done. And then I went and I got it done, and we were thinking probably BRCA1, BRCA2. And we just did the whole panel because there were all these random abdominal cancers or people. It was just bad family history reporting about where these cancers actually were. And then the testing came back positive for CDH1. I was shocked, first one in the family, the proband. So I had no idea what to expect from there.
Yeah, had you heard of CDH1 before?
No, I was working under a clinical genomist in a research lab for a inherited bone disorder. So I had known like a lot about different genetic mutations and inherited forms of things, but I had never heard of CDH1. And after that, I put a lot of time into looking into the data and research on it, and trying to figure out whether I liked my odds or not based on what my mutation was. And it was very stressful.
And how many years ago was this that you discovered your carrier?
It was in 2018,
Okay. Oh, no. Okay.
just at the beginning of 2018.
And so then were you able to be like, oh, it was this side of my family, not that side because of the gastric cancers that you had? Or did you have to have somebody else tested to confirm?
So we were pretty sure it was my dad's side at that point, just because there had been more sporadic cancers on his side. At that point, we didn't know anybody who definitively had gastric cancer. Looking back now, there's a few people in our family that we probably could have been like, oh, that, it's likely that was the source of things, and maybe it spread somewhere else in their GI system. But pathology in rural Iowa wasn't very good, especially 20 years ago. So yeah, then my dad got tested just for us to learn a little bit more about it as a family and figure out if he was the carrier, and he was. So my dad has tested positive for CDH1, and so did both of my siblings.
Oh my gosh, it's like our family.
Are they older or younger than you?
Older. My brother Zach and my sister Jessica, they're both older than me.
And have they gone through with their surgeries?
My sister had her gastrectomy about a year, actually almost exactly a year after I did. And then my brother is just in the clinical trial at the NIH, so he is getting screened every 6 months by Dr. Davis.
And your dad is not participating in being screened?
He is not. He just is kind of happy with how his life has gone so far. He's in his 60s, and he doesn't really have an interest in changing how his life is right now.
Right.
I don't blame him. That's how our mom is too.
Yeah, our mom, she only goes with us to NIH because we have fun there.
Yeah, my dad, since he got tested, he had gone through treatment for prostate cancer twice. He had his prostate removed right before I got diagnosed, and then he ended up having to go through radiation about a year later. And at the same time he was going through radiation, his younger brother actually got diagnosed with gastric cancer and passed within 7 weeks of his diagnosis. So my dad has a lot of survivor's guilt from that, and I think it's just deterring him from wanting to go through.
Oh my gosh.
Right.
That has got to be
7 weeks, and it was the hereditary diffuse gastric cancer?
Yeah.
Wow. And how old was he?
He was, I think, 56 at the time.
That's so sad.
Wow.
So is prostate cancer associated with CDH1?
There have been kind of some preliminary indications, but there's nothing that's like clinically actionable at this point.
Okay.
Discussions that I've had with a lot of people seem to be that because people are now surviving past to the point that gastric cancer could have got them, they're noticing more links. So in the next 10 years or so, there's probably going to be a lot more information about different types of cancers that might be related to CDH1. And I think
good.
as I think you guys had discussed a few years ago when I was first kind of jumping on this boat, everybody's family kind of presents differently, and my family was primarily breast cancer was what seemed to come through, but now it's not necessarily the case. We have gastric cancer cases in the family that we've figured out are definitively related, so it's kind of a toss-up. You never quite know what's coming.
No, you sure don't.
No.
It's the luck of the draw, isn't it?
Yeah.
So
did you do your breast first because of your family history, or did you do gastrectomy first?
I did. It was easier for me to come to terms with that because I already knew, like, I grew up thinking these things are going to kill me. Let's just get rid of them. I also knew that I wanted to go to medical school before any of this happened, so I was trying to just get all of my surgeries out of the way, get it done so that I could start school and already have adjusted to the nutritional needs and the changes in my life and whatever. So it did take a lot of convincing to get a physician that wanted to move forward with that when I was 20 years old. So I had my mastectomy in April, when I was 20. And then right after my 21st birthday in August, I had my gastrectomy. And then I finished my reconstruction the following February. So I had those tissue expanders in for like 9 months.
Oh my gosh, how awful.
It was all right. It was not the most comfortable, but it was doable.
Wow. So how many months after diagnosis did you move forward with your mastectomy?
It was quick. I got my diagnosis in January, and I did my test, sent it off right before the holidays, got diagnosed in January. I did my like GI visits, my consults, everything, for both the breast and gastric route. And then I had my surgery at the beginning of April. So it was just like a whirlwind of appointments leading up to that.
Wow. And tell us about your pathology on your breast. Did they find anything in there?
They didn't find anything. I was so young that they didn't really expect to find anything for either surgery.
Mm-hmm. True. Right.
How old were you when you had it done?
20.
20? Okay.
20, 21.
So where did you go for your mastectomy?
I got all my treatment at Mayo Clinic. It was close to home, and luckily they're more of a specialized center, so it worked really well.
Right. Did you have any complications with your surgery?
No, I didn't. I was really lucky. I ended up going non-nipple sparing. I just wanted everything gone, and sorry, I keep seeing it's like darker on my screen. I'm trying to fix it so that I can see you guys better.
Yeah. Well, we can see you perfect. So
okay. All right. Sounds good. Yeah, it was pretty smooth rolling. I healed really fast, and other than having the tissue expanders in for so long, it was pretty easy for me.
Did they put the tissue expanders in right at the mastectomy, or was that a second? Okay.
So you had the 2 surgeries for your breasts.
Yep.
Okay. I did not do nipple sparing. In hindsight, I did do nipple sparing, but hindsight, I kind of feel like I shouldn't have.
Well, you can always go back and cut those off, right?
Oh, maybe.
Yeah.
Yes,
probably. I just didn't want to have the headlights on all the time.
You should just do it. What's that?
I didn't want to have the headlights on all the time. That was my big concern. I didn't want to have to wear padding just to keep them down.
I definitely have that going on.
They are hard all the time?
They're always hard.
Oh, yeah. Weird. I didn't know that was a thing.
Oh. They warned me of that beforehand, and that was one of the main drivers in my decision.
Yeah, I just go with it now, though.
You don't have to have a bra. It's already smooth. That's kind of nice.
I do, though. I don't like the skin-on-skin feeling. So I always wear, like, a sports bra. It just makes me feel more comfortable. But it's nice to know that I don't have to if I don't want to.
Right. I have to wear a bra. Like, it's so uncomfortable. Really? Like, I sleep in it.
I sleep in one, too.
Yeah. Are you happy with the outcome of your surgery?
I am.
Hoops?
Yeah, I think they look great. I think they look better than they did. And I do think about going back. You know, like my left one is starting to get a little bit firmer, and I don't know if I should go for like massage therapy to loosen that up, or if I'm going to need another surgery down the line to kind of break up some of that scar tissue or whatever is encapsulating it. But
yeah,
it's not too bad.
Good. And you have that worry behind you.
Yeah.
That's wonderful.
Yeah.
So April, you had your mastectomy, and then you said August the following year was your gastrectomy.
Yes. Same year. So it was April and then a few months later.
Oh my gosh, that was quick.
That's why I had my tissue expanders in so long, because they wanted me to go through the weight loss the bulk of it after the gastrectomy, so they wanted to wait until I was mostly stable on my weight before we did that.
That makes sense.
That's really smart. Good.
So they probably weren't doing all the fills and stuff too, because that's pretty uncomfortable.
I only did 3 fills, and then I reached the point that I was happy with. But interestingly enough, the fills that I had, the volume was at like 300 cc's, I think, when I was filling, and then I went to like a 500 cc implant. So it was, I guess, I don't know if it was just taking up extra room with all of the bulk of the tissue expander being thicker or what, but they actually, the volume I went with was much bigger than what was filled. So.
Wow. Well, 500 cc's, what size breast would you say you are?
I am probably like a D, double D.
Mm-hmm.
Yeah, I am almost exactly what I was beforehand.
That's
wanted
nice.
to go smaller, but the shape is so different that I just told my surgeon, do what looks good on me and I'll trust you.
Yeah.
Good. So then in August, you went down the path of gastrectomy, which you were the first in the family to do that.
Yes.
That's pretty scary.
How
And
did you
being just
feel?
2020.
Yeah. Did you know that you were gonna do it, or did it take yourself some convincing to come to that determination?
I was terrified. I spent the whole day after I got my diagnosis. I was at work and I just told everyone, I'm gonna leave for the rest of the day probably. I might come back in a couple hours. I just need to go meet up with my mom and like talk through things. And we were online, and at that point, the information online was, if you Googled total gastrectomy diet or whatever, it was like, you'll never eat fresh vegetables again, you'll never eat raw anything. And I was going down the list like, okay, what of these things will I be okay parting with? If I never eat a strawberry again, will I be heartbroken? Can I eat raw broccoli? And so just to think now that those were the things that I was scared by is so strange, because now I feel like everyone's done such a good job of getting real information out there about what it's like afterwards that it's totally ridiculous. I can eat everything I ate before, and yeah. So
were you like a plant eater? Like, did you eat a lot of fruits and vegetables beforehand?
I really enjoy fruits and vegetables. I am not like as plant-based as you guys are. I eat just kind of whatever I feel like eating. But I do like to have fresh fruits and veggies, and so I was really scared that I wouldn't be able to.
I'm glad to
I'm
know
scared
that you
about
can.
that,
And
too.
I bet that being young was on your side.
Yeah.
Yeah, I think so too. I'm happy that I did it when I did.
Yeah, it seems like a lot of the younger seahorses that had their surgery younger are the ones that are thriving the most.
I think so.
In general. I mean,
in general.
In general.
Yeah.
It does make me nervous because I'm not good at being compliant with any medications or vitamins or anything. I suck at it. And so I am nervous about my bone health long term. But that's something that I won't know what the impact of that is until it's 30, 40 years down the line. So
Right. Where did you have your gastrectomy?
I had it at Mayo as well.
At Mayo, okay.
In Rochester, Minnesota.
And your pathology of that was also clear?
Yes, but after going to the NIH, Dr. Davis made it seem like if they had looked harder, they would have found something.
Yeah, right. He tells us that too.
My endoscopy that I had before my surgery, right after my diagnosis, I did not tolerate the conscious sedation at all. I felt everything. I was screaming the whole time. They had
for what?
For my endoscopy.
Oh my gosh, that's horrifying.
So they did like the same as a normal colonoscopy would be, where you're like groggy and tired, but it's fine. I was totally alert. I was kind of like loopy, like you are after you wake up from surgery, I guess, but I could still feel all the pain. I could feel the pinching. It was awful. And I can remember laying on the table and like trying to sign hurt in sign language, thinking somebody might know that obviously they knew I was hurting. I was thrashing. But I remember physician that was performing it storming out after 16 biopsies saying, if she's ever coming back, she's going under general anesthesia. We're not doing any more. The procedure's over, and like left the room.
Angry?
Just, yeah, frustrated because they had maxed out the medications they could give me in that like area since it wasn't equipped for me to go under full anesthesia without preparing for it. And I think he was like, I can't get any more out of this. So I
makes me wonder if your IV was like, you know.
No, I mean, they've given me everything, but I don't respond well to that medication. I never have done well with like Novocaine or anything like that. My mom wakes up in surgery, like, I don't know, we just metabolize it quickly, I think.
Right. But that had to be scary then going into your gastrectomy, but I mean, of course that's general.
Well, that was part of, I was rushing to schedule my gastrectomy because I did not want to have another pre-op endoscopy. I was like, let's get this as close to now as we can so I never have to do this again.
Right.
And then after my gastrectomy, they said they had to keep cutting to get clear margins from the gastric mucosa in my esophagus because my mucosa kind of mixed in higher than they were expecting. And my surgeon wanted me to go back and have an endoscopy just to make sure they got all of the mucosa.
Oh, no.
And I said no. I was like, I got this surgery for peace of mind more than anything. We removed, like, you know, the last couple cells are not what worries me. The endoscopy is what worries me, and I never went through with that. I didn't want it. Yeah. So I might
what would the endoscopy show? Because if they're taking the biopsy during surgery.
So they cut sections during surgery and they thought they got it all, but I think he wanted to get more thorough biopsies up and down to see if he caught anything else that might have gone under the radar or wanted a revision or something.
And that would just be like a needle in a haystack too.
Right.
Yeah.
I probably would have done the same as you.
Yeah. I just didn't want to, I wanted it done and behind me at that point.
Yeah. Like, I'm done with surgeries.
And I'm sure, as you guys know, just kind of like the emotional trauma of going through that whole mess. It's kind of nice when you just get to be on the other side.
Yes.
So was your surgery open or laparoscopic?
I had laparoscopic.
Okay. Yeah. And how was your recovery?
It was mostly just pain from the gas that they use to bloat you up for the operation. So when you have it laparoscopic, they have to like inflate your abdomen so they have room to work and whatnot. All that gas kind of dissipates into your joints afterwards. So I just had extreme back pain after my surgery, and that was about it.
Like up here in your shoulders.
Yeah, my shoulders hurt. Just horrible pain in my right shoulder afterwards, but it only lasted a few days and then I felt okay.
Really?
Yeah.
And how do they do that at Mayo? Do they have you eating and drinking right away, or do they do the leak test first?
So they do a test before they take you out of the OR to check for leaks. So I didn't have to stay for any additional tests from that perspective. I was supposed to stay overnight and then be discharged halfway through the next day. I was in too much pain, so I stayed 2 nights. They had me on liquids after I woke up from surgery, and then they moved me to soft foods by halfway through the next day after they rounded on me.
Oh my gosh.
Wow.
And you didn't
have you went home after 2 days?
Yeah.
What was it like when you got home?
It was fine. I was really scared of meat and just anything hard. So I had like mac and cheese and pretty much survived off of Panera mac and cheese because the protein content is there. It has a lot of protein and a lot of calories for a small cup. So that was my go-to food after gastrectomy.
Were you staying with your mom for your recovery?
I was living with my parents since I was just out of college, and they took care of me afterwards, which was nice to have people there.
Yeah.
And I want to know, how much weight did you end up losing?
I lost probably 80 pounds. I bulked up before surgery. So after I got my diagnosis, I was eating cheesecake every day. I was eating, most people try to get fit or healthier beforehand. I did the opposite. I thought I was never going to know if I could eat anything else ever again. So, I had gained weight up to about 250 pounds, at the time of my surgery, which I kind of regret now, but anyway. Then I lost down to about 180.
Wow.
And then I stayed.
Why do you regret it?
My skin's a little looser than I would like. It didn't bounce back as well. I have some more stretch marks than I had before just from that weight gain.
Mm-hmm.
And I started snoring again when I gained weight. Really bad, and even after I lost it, I snore so much that, like, right now I have a sore throat because I was too snory last night. But
really?
Yeah.
You would think that would have been resolved when you lost the weight.
Right.
Yeah, but it just stuck around. So
I wonder if it has anything to do with the gastrectomy too, though.
Right. Maybe.
I don't know. I wouldn't think so, but maybe.
Yeah.
Bodies are so weird. Everyone responds to everything differently.
That's so true. Yeah.
Right. So no complications post-op.
No.
Were you like, why was I so scared? I should have done this sooner.
Well, she really couldn't do it much sooner.
But like,
I could, but I also felt this pressure. I don't know if my brother's still watching, but I felt this pressure to be strong for my family as the first one because I really wanted people to follow my footsteps and to get tested and to make informed decisions about everything. I am very anxious, and for me, it was really hard. Hi, Zach. My brother is still on. It was really hard for me to set that example for my family and not, I don't know. I just felt like I had to be strong through the whole thing. I had to make it look easy so that everybody else would go get tested and go get it done. And it worked on my sister.
So interesting because you're the youngest, but yeah, you were taking the older sibling role.
Right.
Yeah. My sister did follow up pretty well. She was classy about it. She was quick about it, but she did, I don't know. I think she felt like I maybe I did a good enough job of making it seem like a walk in the park. My brother's commenting. She paved the path for all of us and was super brave while we were skeptical. My dad's extended family didn't believe in genetics. They thought I was crazy. They thought it was insane. But it is what it is, and I had to kind of step up since I was the first one to get diagnosed. Nobody else would get tested if I didn't make it look like it was something worthwhile.
Right.
Yeah, and look at what you've done. You're saving your family.
That's so cool.
Your brother's being monitored, so that's nice.
Now, he's going every 6 months. Does that mean that they found signet cells?
Yeah, on his first endoscopy at the NIH, they found a couple locations of signet cells, so he's doing well. He just had another follow-up, and every time it seems to be pretty consistent. It's not growing at this point, so.
That's like you.
Me too, yeah. I had 3 with signet cells.
Yeah. So he's hoping to wait
another year. Huh?
He's hoping to wait another year before going through with the gastrectomy.
Oh, so he is planning on doing it, though.
Eventually.
Yeah.
Yeah, you definitely have to do it when you feel right about it. Otherwise, I don't think you'll be as successful.
Exactly.
Like, you have to feel good about it. So then you're positive.
Yeah.
About it, you know.
And it's so traumatic. Like, emotionally, you have to be ready to do it. Otherwise, it's something that you can get plagued by for a while. Like, it can really put you at rock bottom if you're not cautious.
Right.
Did you go through a period of depression afterward?
Well, so I have a long history of mental health conditions. So I went, before my surgery, I started taking like the liquid version of my antidepressant, and it was horrible. It tasted so bad, but I did that for a while. And I did feel like I had kind of this what's next. Like, I still have that. It's like scanxiety all the time. If I get too many bruises, oh no, it's not anemia. I probably have like leukemia or something, you know?
Yeah.
But I think that I drank more about a year after my gastrectomy. Like, I was just not in a good place, and I was coping improperly, and now I feel good. And so at the same time that I was going through all my surgeries, right before I had my breast reconstruction finished, I was applying for medical school that whole time. I took my entrance exams for medical school the first time like 1 week after my diagnosis.
Oh my God.
Yeah, that's a lot.
So
The focus.
Yeah.
So trying to explain that in my interviews when I'm like traveling across the country for a med school interview and I'm still on a weight restriction from my surgery, I think it was clear to everyone but me that I wasn't ready. I was in a bad place. I was not equipped to handle any extra stress in my life beyond CDH1.
Right.
Now I can look back and see that that was the case, definitely. So the first time I didn't get in, and then it gave me that freedom to take an extra couple of years to really like get over everything that happened.
Mm-hmm. Did you
You're
do that
mentally
on your
strong.
own, or did you have a therapist help you with that?
I've never really gone through therapy. I met with some people, so my care team set me up with a social work visit and kind of an evaluation when I first got diagnosed. They wanted to make sure that I was like sound after receiving that information. But I feel like I'm a very insightful person, so I always tell myself I like don't need to go through talk therapy. But then my partner is like a therapist, so I guess whether or not I was seeking it out, I ended up with one for life. So
That's nice.
Now, how has your life changed from before to now? You said you're still eating all of the same things, but what has changed?
I do get like hypoglycemic episodes or late dumping syndrome. I never really get early dumping anymore. I used to when I would eat ice cream. So I just cut out ice cream for like 3 years, which is not something that was really missing for me. It was fine. I didn't eat it that often. But now it's mainly just being conscious of what my sugar intake is. So I can eat everything. I just get a smaller slice. But if I get like more than 30 or 40 grams of sugar in one sitting, I do end up like 2 hours later, I'll have a crash. Sometimes it looks like sweating and irritability. Sometimes it's bad enough that I'm like shaking and confused. And I've noticed, I'm not sure how, but when I'm having more stressful stretches of time, and I'm just like overwhelmed in general, I feel like that makes it worse or more frequent. I don't understand it, but
Hormonal, probably.
yeah.
And then when you say 30 grams of sugar, is that added sugar, like natural sugar, like fruits? Does that count?
I haven't really tracked it that close lately. I did when I was first out of surgery, and I don't think this popped up until almost a year after my gastrectomy, probably because I was so careful with my nutrition the first year. But now it's, if I'm eating too much candy or if I eat fruit snacks. Yesterday I had 2 bags of the little Scooby-Doo fruit snacks before I had lunch, and that really like sent me off the deep end. I ended up having to take the afternoon excused from school because I was just like confused, had to go try to make a hodgepodge meal that had enough protein to get me out of it, and then fell asleep, took a nap for like an hour and a half. And then
So when you have a dumping episode, it takes hours to recover? It's not like take some juice and then you're good?
Yeah, for me, it after I recover, usually I am so fatigued, and sometimes I get a really bad headache afterwards. So even though I'm out of that like confusion shakiness, it just kind of takes all of my energy out of me. It takes me a couple hours to bounce back.
Wow. And so in medical school, that's a lot of hours. You're not only in school, then you're doing your rotations. So that, I don't know how many hours a week that is, like 60 plus hours.
Well, right now I'm just in like the textbook learning part. So we have the first 2 years are like classroom based, and we have like mock patients and and learning things on each other in the classroom. But I don't know how it's going to look when I'm in my rotations. I hope that people are gracious, but I truthfully have no idea what it's going to look like. I know that now
your lunch boxes full of food, huh?
yeah, I think I'll be okay. I'm kind of a grazer, a snacker anyway. But I'm not sure what it's going to look like if I have to leave in the middle of the day at that point. It's not frequent for me that happens, but it does eventually happen.
Is it how frequent? Like once a month?
So usually these episodes happen at night just because either I'm having like dessert and I have a glass of wine with it and then that flares it up, or I'm sitting at home watching TV and I'm not keeping track of what I'm eating, and then I go overboard. During the day it doesn't usually happen that often. I think this is the first time that I've had to miss school because of it all year, and we're 4 weeks from the end of our school year, so very seldom does it impact my work. But
well, it seems like it's manageable then if you know what the triggers are,
Right.
and then you just unfortunately avoid that. But gosh,
Yeah,
you want to have a glass of wine.
Yeah, is wine? Yeah, can you drink wine, or is it because you had dessert and wine that it makes that?
yeah, I can drink wine just fine. It's just when I mix it with something that's more sugary, and usually that's okay. But my body just kind of decides when it's going to be mad at me or not.
Yeah.
And hard to find a rhyme or reason to things. Some days it's fine, some days it's not.
Right.
And does the Mayo Clinic follow you like NIH follows their patients? Do you have a nutritionist and get your labs done?
I mean, I could reach out to one. They have a good patient portal, but there's nobody really coordinating things afterwards. They just kind of I don't know if MD Anderson is this way as well, but they just kind of see you, and then once you're done being followed up, once you've had surgery and don't have complications, they don't really follow you ever.
Right.
So
you said you're really bad about your vitamins. Do you take the multivitamin and the calcium citrate for your bones?
I take them as much as I remember to.
Mm-hmm.
I have to be kind of handheld. My partner makes little, I'll show you, I have it with me. Puts my vitamins into a little I call it it's like a fruit snack pouch for me.
Yeah.
So then when I remember to take it, I've got I ended up getting a multivitamin that doesn't have calcium in it or doesn't have iron in it, so that I can take it either with my calcium or my iron. Since I tend to not get everything in one day, I just think of which one I've been slacking on. And I've got the calciums, and these irons are so good. Every other iron sucks, but these Cherry Burst Iron 45s from
They're like Starburst.
What is the brand? Celebrate, I think.
That's such a great idea. I didn't think about that. That if it doesn't have the iron, then you can take the calcium at the same time. So you just need to take the iron once a day, 2 hours apart, right?
Yeah.
Maybe even just right before bed or something.
And
does
then I got...
does it make your stomach upset or your...
I don't have issues with iron. I do have issues with the multivitamin. So I don't know what part of it doesn't agree with me, but
have you tried other multivitamins?
Yeah, I used to take the capsule ProCare one, or the one that smells like dog food that the NIH uses.
Ooh. I ordered those. Now I'm so worried.
I don't like them, but if you are okay with a pill quickly and then not having to taste it afterwards, I don't like it. So I went to go get chewable ones, and I like them better, but I always have different flavors on hand of the calcium and different of the multivitamins, so that I can kind of choose what I feel like eating that day.
Mm-hmm. Yeah. Like a buffet.
Yeah. I'm like a little kid. You have to keep me interested, otherwise it's not going to work.
And so how is that with your partner? Because you're having to eat more. Like you said, you're grazing all day. Is your partner...
Oh, I eat more than she does.
Oh, really?
So, picky. She eats the tiniest little meals, and I eat pretty big meals.
Well, that makes it easy.
And are you the cooker, or is she the
I cook everything. She has the food taste of like a fourth grader. She does not like anything that's too adventurous. She doesn't like too many vegetables. So I cook something that I can like make either way. So like a lot of grilled chicken, and I'll like grill asparagus or whatever for myself and have it with rice. And for her, I turn it into a chicken sandwich. You know.
Oh, that's good.
Yeah,
It's good to know you can
I'm
still eat
so
vegetables.
happy to know that you can eat everything.
Yeah.
Like salad.
Yeah, I can eat salad. Kale was difficult for me the first year. I haven't really had much kale since then, but yeah, I'm not missing out. I can still have like lettuce or arugula or whatever, but
You just have to chew it a lot?
yeah.
Yeah.
Yeah, and come to terms with a lot of it coming out the same way that it came
Right.
in.
Yeah.
But
Yeah, okay,
it's
this
crazy.
is this might be
Yeah, it might be TMI.
TMI, but my husband asked me the other day, you haven't ever asked anyone about their poop. Do you
mind us asking?
Yeah,
you?
can we
You
ask?
can ask me whatever question.
Is it solid?
Sometimes.
Okay.
Every day is a little different. Softer than it was once, but it's not always loose.
Okay.
And do you have problems with gas?
Used to the first like 2 years, horrible. Still smells bad, but less like horrific. It used to be like a big nighttime farter, like full room, horrible. Now depends what I eat.
Okay. Yeah, everyone says the gas is really bad the first year. That'll be interesting. I'm gonna get you back.
Microbiome adjustment, you know.
Yeah.
The bacteria is learning what your new diet is.
Exactly.
Yeah.
What's your water intake like? Can you drink water?
I can. I drink plain water all the time. This is just water. I like liquid IV sometimes just to have a different flavor.
Mm-hmm.
I drink a lot of coffee. Right after my surgery, for some reason, I was super averse to the flavor of coffee, but I love it. So it was like unacceptable to me. So I just started drinking it until I liked it again.
Yeah.
Typically for me, it's like I drink coffee until I've had too much and then I switch to decaf. So usually like 2 water bottles a day is all I end up drinking.
That's good because that's like a 32 ounce, isn't it?
Yeah. My normal one is 40 ounces and then I only have like one of them, but yeah, it's pretty
good.
Wow. And are you able to like drink it normal, or do you have to take little sips?
I don't chug it, and I prefer to drink out of a straw now. I think I just get like less air with the gulp, so it doesn't get trapped.
That's what Catherine said. Yeah.
And then with food, as far as things getting stuck, I just try to like never eat dry meat or if something's too dry, it's gonna get stuck.
Okay.
I was wondering about that. Like if you were choking, did they ever tell you, like, do you do the Heimlich?
Yeah. I mean, choking would happen like a lot higher up. So it would.
But you don't have the stomach to
the air to
pop it up.
I think it's just the pressure of like all of your organs coming up to your diaphragm. But yeah, it is one of the most unpleasant things of this whole experience is when food gets stuck. It's awful. And don't drink water. I can't drink water to push it down. Like,
what do you do? Just give it time?
Yeah, I don't eat anymore until it's down. I don't drink anything. The first time it happened to me after my surgery, I was at like Bruegger's bagel shop, and I got a huge chunk of bagel stuck, and I tried to take a sip of water, and it just creates like an explosion. So all of the water comes back up. So I didn't know this at the time, and I just ran. I knew I was like, I'm nauseous. I don't throw up. Like, it's impossible for me. I don't know how some people do after gastrectomy, but I can't. But I like ran to the corner around like where I thought there was a bathroom, noticed it was only a men's room, then turned to the side in the hallway and just like spit all of the water and the chunk of bagel back up onto the ground.
We got it out.
Yeah.
That's good.
I had to like go get napkins from the table and go wipe it up. It was so embarrassing, but
Oh.
at least I learned I don't drink water. So anytime somebody is like, take a sip of water, try to push it down, I get this look of like deer in the headlights.
Yeah.
Yeah.
Like,
And you haven't had to have any of the stretching or the dilating?
No, I haven't. I've been pretty fortunate that I haven't had to have any of that.
Wow. You're just like,
I know.
you're like what I want my case
The
to be
outcome.
like. Yeah.
I did have a time of things. I'm very fortunate. But I think
Yeah.
it's important that I still talk to people about it because it's not all doom and gloom like sometimes things seem on the internet.
Right.
And then I feel bad because I try to like chronicle, at least I started to try to chronicle how it's like going through med school with all this going on. And I feel myself doing that where I'm just posting the negatives. Like, this is what happened that I hated. This happened and I hated it. And I'm not doing a very good job of keeping people up on the positives.
It's easy to
Yeah,
focus
it
on the
is.
negative. I mean, that's just the way it is.
Well, and it's not a lot to report if you feel good.
Right.
Like,
Yeah.
Yeah, feel good.
Yeah.
Mm-hmm. Yeah.
Doing good. Oh.
So do you have any advice or words of wisdom you want to share with us or anyone who's CDH1 positive?
Yeah, I mean, nothing is definitely going to change. Something might change, but it's not going to be like you can't ever do these things again, or you're going to be so restricted that you hate your life. Like, don't listen to everybody who's had the worst outcome because they're not representative of everyone.
Mm-hmm.
I know plenty of people who do end up like on disability or staying at home, but even those people have super fulfilling volunteer interests, or they've had maybe some more complications with other health conditions that they had. It's not like you're going to have surgery and then be stuck at home depressed and in pain the rest of your life. You can be perfectly happy and successful and thriving even though you just had an operation.
Right. It's an operation.
Yep. Pretty big operation.
But that's really good for you. I think for Polly to hear, I think that's really good advice.
Yeah. And probably just, I don't know, do you think it's best to just live when you're like down, like in the beginning when you're struggling? Do you just like focus on that, or you just tell yourself it's going to get better? Like, how did you get through those tough times?
It's hard to remember. Honestly, I feel like after you're on the other side, I at least had a moment where I just needed to like remove myself a little bit from the community for a minute and just realize that life is going on and I can kind of dwell on it or I can look forward to the things that are going well. So I just really focus on the positives, and it hurts. Like, the after surgery pain hurts. The getting over the things that happened during that, like trauma of going through an endoscopy. That stays with you. I was working in the same hospital, and every time I went down to that floor for whatever reason, had to walk through it, I was like nauseous, and I like had a visceral reaction to just being in the same place that I knew I had that procedure done in. And those things stick with you, but eventually you just kind of, it's like every other rut in life, you find a way to move forward. And every day it becomes less of something that you think about and less of something that bothers you.
Right. Wow. Well, I'm so grateful that we got to talk to you. You're an inspiration to me.
Yes.
Aw,
For sure.
I'm happy to talk to you whenever you have questions.
Oh.
Yeah. Thank you so much
Thank
for
you
being
so
open
much.
and sharing those intimate details, even though you maybe didn't want to.
I'm
like
open
an
to
open book.
questions. I don't hide anything. So
Thank you. Well,
Yeah.
you're going into medicine, so
Right. Exactly.
it's hard for me to put that filter on though sometimes.
Yeah.
You know,
Yeah.
but I worked in oncology for a little bit on clinical trials for like cellular therapy with blood cancer patients. And it was really hard for me to not be like, oh my God, this happened to me after, like, I was feeling this way when I was going through my things and whatever. And to a certain point, it's okay. But then to another point, you're not there to be their peer. You're there to be their provider.
Right. Yeah.
But I'm sure they appreciated
I'm
that.
sure they did. Yeah.
I like that when my doctor gets down on my level.
Right.
Yeah.
Makes it personal.
Yeah.
Yeah. Oh, well, thank you so very much. And
Thank you for having me.
yeah, it's so good to meet you and talk to you face to face.
Yeah, nice to talk to you guys too.
All right. We'll see you later.
Have a great rest of your
All right.
day.
Bye.
Bye.